Hi, everybody, and welcome to the 2023 CCLP Legislative Preview event. As we go through the event today, you're going to hear from a number of our staff members, a lot of great information to share with you. And as questions occur to you, go ahead and put them directly into that chat box. We do have a Q&A box, but we're not really going to use that today. We'll check it if you put something over there instead. But for the most part, if you have a question, just go ahead and put it directly into the chat. And our esteemed colleague Morgan is monitoring that chat channel, and she'll be grabbing all of your questions and putting them in a document. So we'll get to them in our Q&A section at the end. And with that, we're going to get started. And it's my great pleasure to introduce our interim executive director here at CCLP, Bethany Prey, for a few opening remarks and to get us started. Take it away, Bethany.
Thanks, Bruce. I'm so glad to see everyone back and ready to go for Colorado's 2023 legislative session. CCLP's vision, a Colorado where everyone has what they need to succeed, is integral to the priorities you'll be hearing about today. Last session, we played a major role in shaping some powerful legislation that was signed into law, including a bill that reforms Colorado Works, the cash assistance program that helps lift up families that face extreme poverty. Another key win was the Clean Slate Bill, which automates sealing of records and will reduce barriers to employment, housing, and education for many thousands of Coloradans. Economic justice and advancing the rights of people facing poverty are at the center of our agenda for 2023 as well. Leading legislation isn't all we do. We also support the great work so many others do in the anti-poverty sphere by sharing expertise we have on staff. Whether that's legal analysis or communication support or testimony, and helping shape policies that can be successfully implemented and thoroughly enforced. I'm excited to introduce our legislative preview with some key proposed legislation to be discussed by members of the CCLP team. Shar Robert, our legislative director, Laura Ware, policy consultant, Julia Char Gilbert, Connolly policy advocate, and Charlie Kessler, policy fellow. We couldn't do this work without the amazing contributions of all of you who have joined us today, our dedicated legislators and government partners, and the community members who come down to the Capitol week after week to testify about what they know best. We're looking forward to more groundbreaking work this year. And now I'll pass the microphone to Shar Robert, who will introduce our legislative agenda.
Thank you, Bethany. Welcome, everyone. Happy New Year. We're pleased to see so many of our partners in advocacy. I've been reading the chat, and it's great to see so many of our partners in advocacy who've worked with us over the years on income, housing, health, and food. As we look forward to the session about to begin, I have organized my thinking around three types of bills that can help struggling families and marginalized communities. And those are, first, bills about services and programs. Secondly, bills about tax policy changes. And third, bills around rights and the balance of power. So first of all, bills about services and programs. So these include bills that establish new programs or that modify or expand existing programs. And recent examples from the last few years would include legal help for those facing eviction, rental assistance, Medicaid coverage for a full year postpartum, the Health Insurance Affordability Enterprise Fund for those previously unable to get healthcare coverage due to their immigration status, an opt-out retirement savings program for workers who have none, who don't have a retirement savings program at work, and school meals for all beginning in many areas this fall. So new or existing or expanding those programs to help meet growing or new needs. The biggest challenge is that most of those kind of bills require funding through the state general fund or some other source. In the past year and a half, the Federal American Rescue Plan Act, or ARPA, those dollars have helped fund program expansions to meet the growing needs in Colorado in the areas of behavioral health, housing, workforce training, childcare, and many other arenas. The legislature itself allocated $3.6 billion. That's of a total of $9 billion in federal ARPA money that came into the state. These are one-time funds. The state has until December 2024 to obligate all these ARPA funds and until December 26 to spend any remaining ARPA funds. We do not expect Congress to approve any new large wave of funding, to say the least. But money for new bills or to replace ARPA funding will be very limited in the coming year. Even if we do avoid a recession, and even if our tax revenues are healthy, TABOR, or the Taxpayer Bill of Rights, will prevent Colorado from increasing general fund spending, except for adjustments for inflation plus population growth. And recently, population growth has slowed. For these bills, it's less about the opposition than it is about prioritization by the legislators of which of many bills to fund. So the second type of bill is tax policy change. These deal with questions of who should get tax breaks, what should be people's fair share of taxes, what are the values expressed by our tax policies. Recent example of state policy changes benefiting those who struggle to meet basic needs include the creation and payment of a Colorado state child tax credit and the expansion of the state earned income tax credit, or EITC, both proven poverty fighters. This past year, legislators overwhelmingly approved a one-year only change to rebate most of the projected TABOR surplus through a flat $750 per person check. You may remember those. This approach should be made permanent this year rather than reverting back to current law, which gives the largest rebates to those who have the highest income. Our Constitution requires revenue above this TABOR limit to be rebated, but legislators still can choose different ways to distribute the money. On the negative side concerning taxes, voters did approve a permanent reduction in the state income tax rate at the ballot, lowering our rate from 4.55 to 4.4%. And that shrinks Colorado's tax revenues by over $600 million each year. Income tax rate cuts benefit most those individuals and corporations who have the highest income and benefit those with the lowest income little or not at all. In fact, income tax rate cuts, they actually reduce the TABOR rebates for struggling families as well as anyone else. So the third type of bill, and these are the bills that I would expect to be the most active aspect of the 2023 legislative session, are bills that advance rights and shift the balance of power. Some recent examples of such legislation include paid sick days, salary transparency in posted jobs, clean slate, protection of mobile home park residents, the Towing Bill of Rights, and hospital billing and collection requirements. We have many new and returning legislators who ran on passion and promises, and they want to sculpt important values and protections into laws. While such bills tend to have a smaller fiscal note, These bills tend to have fierce opposition from interests who prefer having more power and control and who benefit from the status quo. CCLP is active in a number of coalitions working on such bills, including those which affect job quality and worker rights, those advocating for tenant protections, and those advocating for consumer and client protections. Most of such bills are led by our partner organization, and they're still under wraps. Since opposition to such bills tends to be fierce and well-funded, most groups prefer to shape a bill first before meeting with their likely opposition. So as we review some of our priority bills today, we welcome your organization's formal support. Please email me if your organization can be listed as a supporter of any of the bills we mention in the next few minutes, or if you would like to be more involved. I would also like to acknowledge our contract lobbyists, Frontline Public Affairs, with Jennifer Miles and Lisa Ward, who are helping us with the bills that you'll be hearing about today. We have seen the important role policy can make in people's lives, from how much they get paid and what benefits they get from the job, to tax policies that put cash in their hands. And so many on this call are working on many more things. If you or your organization is interested in advocacy on a particular bill or issue, I can also help identify which organization is leading or working on that issue. Collectively, advocates in Colorado have made major advancements we can be proud of. CCLP's report, overlooked and undercounted, however, documents that more than 24% of Colorado's working age families have incomes that fall short of people being able to meet basic needs without outside help, i.e., they fall below the self-sufficiency standard. It will take all of us, those with direct lived experience, advocates and researchers, funders, supporters and donors, and the media to ensure that Colorado has a place for everyone and creates opportunities that feed hope. So at this point, I'm going to turn it over to Laura Ware from our staff, who will talk about the first bill, SNAP employment and training.
Thank you for this opportunity, Shar, and everybody. I apologize that I am calling in by phone because of some complications living in the mountains. So thank you for your patience. But anyway, I wanted to describe the SNAP ENT bill that we will be working on this year and that we have been lucky to have the involvement of our lobbyists as well. So the first thing I wanted to kind of discuss is the fact that for those of you who are not totally familiar with SNAP ENT, what SNAP stands for is Supplemental Nutrition Assistance Program, and that it was used to be known as food stamps. The ENT component is employment and training, and in Colorado, the SNAP ENT program is known as the Employment First program. So going forward, I will probably be trying to reference it as the Employment First program statewide, although each of the counties tends to have different names depending on how they have chosen to name the program. To give a little bit more context, wanted to really help people to understand that Coloradans whose gross incomes are below 200% of the federal poverty level, in the future known as FPL for this presentation, and whose incomes are below 100% of FPL after deducting eligible expenses, will be able to are considered eligible to receive SNAP income-wise. And so as an example, just again, to give some context, an individual who earns less than $1,064 per month after deducting eligible expenses may qualify for and receive SNAP. So this context, I just wanted to make sure makes sense to everyone, in the sense that the bill that we are trying to get passed refers to individuals who fit into these eligibility criteria. The Employment First program is designed to prepare SNAP recipients for meaningful employment through work-related education, training activities, and work-based learning opportunities, and also to receive supportive services that really provide the opportunity for success. For those who are able-bodied adults and without dependents, and who have historically been required to work a certain number of hours per week in order to receive to continue their SNAP eligibility. Such individuals may sign up for SNAP ENT in order to satisfy their work requirements. These work requirements have been somewhat suspended during the public health emergency, but it is anticipated that as the public health emergency may be discontinued, that more individuals will be required and wanting to pursue SNAP ENT services. So one of the significant responses to the pandemic in 2021 was House Bill 21, which was, House Bill 21-1270. And it appropriated $3 million as well as $3 million in drawdown federal funds to expand the amount of available funding for retraining, training, and supportive services that supported work-related needs due to the impacts of the pandemic. So where we're at this point is that funding lasted through July of this past year. And so the bill that we are now leading is an effort to continue this funding and to really respond to the ongoing need that has not subsided. In fact, it has been proven to be very helpful in terms of expanding the available amount of services to individuals that meet qualifications and eligibility criteria, and has also been able to serve a greater number of counties. So this new bill will be reappropriating $1.5 million in general funding per state fiscal year, which in turn draws down $1.5 million each year in federal funds through the SNAP ENT program at the federal level. The importance of this is to sustain the funding to underserved communities in urban and rural regions and to provide supportive services and work-based learning opportunities to priority populations, which include single parents, students, individuals experiencing homelessness, individuals who have been involved in the justice system or may have ongoing justice involvement, and those who have been unemployed for long periods of time. It also aims to provide services and training to individuals so that they can participate in remedial activities or basic training opportunities that over the long term will qualify them perhaps for more advanced training and workforce opportunities in the workforce system that is more formally funded from other sources. Colorado residents that are currently served by the program are in 26 of the 64 counties, and this bill would aim to expand the number of counties that offer these responsive services and increase the capacity of third-party partners in local communities. This bill is being sponsored by Representative Lindsay and Senator Fields, and additional details related to the formal name of the bill, as well as when it will be introduced, are still being formalized. A fact sheet for this bill will be posted on the website in the next couple of days. So that is the report as to this point for now. One thing I do want to add is that there is a end of the first round of funding report that was published by Colorado Department of Human Services. And we hope to post that on our website as well, or distribute it to the attendees if you're interested. So Sarah, back to you.
Thank you. There's a couple of commonalities between the SNAP Employment and Training Bill and the Adult Education Bill I'm going to be talking about next. You might have heard discussion of how there is only one job seeker for every 2 jobs, or you might have heard discussion about a labor shortage where employers can't find skilled workers. And I think that Colorado often is short-sighted about that whole question. Both of these bills have potential to enable more people to access training and to enter employment and to sustain employment. The SNAP Employment and Training Bill by providing support services and more training. And then adult education helps bridge the gap between where people are at in their educational attainment and really the minimum qualifications for being able to access skills training. So some of the problems, let me define adult education. When we use the term adult education, we're referring to K-12 level education, but for adults, for people who are over 21 or out of high school. So there's about 300,000 Coloradans who lack a high school credentials. And many of these same individuals also have limited or no digital skills. And we certainly have discovered since 2020 how important digital skills are. In 2014, the Center for Law and Policy and our coalition on skills acquisition called Skills to Compete worked on a bill to fund adult education in Colorado. We were able to get about 900, I think, 60 or $80,000 per year towards this K-12 level education for adults. In 2020, Spring Institute kind of led a coalition, which we supported, to focus in on partnerships, not just between the adult education programs and workforce and post-secondary, but partnerships between adult education providers for the adults and the K-12 school system. And 2020, we all recall, it turned out to be very, how do you say, premonition, where before the 2020 legislative session was over, you had a lot of parents who did not have, strong fluency in English, who did not have digital skills, suddenly being in charge of making sure that their child could access school online. And we have seen a real ripple effect in many other areas in terms of the need to have basic digital skills. Without digital skills and without a high school diploma, people face limited job opportunities, lower wages, and challenges more and more in daily activities that require both digital skills as well as a high school diploma. So in partnership with Spring Institute, a multicultural learning, we have some of their folks on the line today. Skills to Compete with Spring is working on a bill. The bill is being sponsored by Senator Zenzinger, who is a longtime champion of adult education, and then Representative Kathy Kipp in the House. The bill does 3 basic things. It first of all makes changes to adult ed. And remember, I said adult ed is K-12 level education for adults, but 42% of the folks have less than a 9th grade education. And a lot of the funding now is really set up around serving people who are very, very close within months of graduating from high school or from passing the GED. And so we really haven't really put the resources where the need is the greatest, where folks are farther away from attaining a high school credential. So it changes in terms of outcome measures and priorities being helping to support adult education programs who are working with the folks who have the highest needs, who have the longest way to go before they get a high school credential. Second of all, it adds digital literacy as a core function of adult ed. And it's been very obvious to those of us in Skills to Compete that, adult ed classes as of March 2020 had to not just be teaching literacy and numeracy, they also had to teach a whole lot of digital skills just to continue education. And so really adult ed programs have been teaching digital literacy to their students, but it has not been recognized. By adding this recognition into the bill, we hope the role of adult ed providers is raised, particularly as the state is working on its digital equity and inclusion plans, that really the adult ed providers are recognized as key players, and that the funding, the federal funding for digital literacy, hopefully will become more available to adult ed providers. The third aspect is to allow community colleges who have adult ed programs, and about a third, I'd say, of adult ed providers are community colleges preparing students to begin community colleges. Those community colleges who have adult ed programs should be able to grant their own high school diplomas. They shouldn't have to go through the GED system or through the K-12 system to get diplomas, but should have that ability to directly grant diplomas. And hopefully from there, it encourages students in many cases to continue on with a skills training or other opportunities at a community college they've become familiar with through their adult ed programs. So overall, more than half of working age Colorado, this again is from the Overlooked and Undercounted report, 53% of working age Coloradans who don't have a high school degree earn less than what it costs to meet basic needs, i.e. they're below the Colorado self-sufficiency standard. And at this point, we're going to move on. I'm going to turn it over to Julia and Charlie.
Great. Thanks so much, Shar. Thanks, Shar. As Shar said, my name is Julia Char-Gilbert. I use she, her pronouns, and I'm the Connolly Policy Advocate at CCLP. And today, my colleague Charlie Kessler and I will be talking about medical debt. We at CCLP care about medical debt for a whole host of reasons, which Charlie will get into more in a moment here. But most fundamentally, we at CCLP believe that medical debt is the product of a deeply flawed healthcare system and a deeply flawed economic system. Healthcare is too unaffordable for too many people, and too many people lack the resources they need to cover even a relatively small unexpected medical expense. Medical debt also reflects and exacerbates inequities in our society more broadly, so this is an issue that's important to us. In recent years, CCLP and our partners have fought to protect Coloradans from incurring medical debt in the first place. So for example, we passed legislation to guarantee financial assistance for low-income hospital patients. We've expanded access to programs like Medicaid, and we've fought to make health insurance more affordable for more people. This year, we're thinking about how policy can help with the downstream effects of medical debt, like what we can do to help the hundreds of thousands of Coloradans who have already incurred medical debt. I will note that a lot of the legislation, or a lot of the details of the legislation that we're working on are still being hammered out as we speak. So we're somewhat limited in the amount of detail we're able to provide today, but we are really excited to share a bit about what we're thinking about and a bit about what we see as key opportunities in this space. So with that, I'll pass things over to my colleague, Charlie.
Hello, I'm Charlie Kessler. I use they, them, area pronouns. So nationally, we know that medical debt is a huge issue. The cost of medical care and stagnant wages has made medical debt the largest source of debt in the country. When the Affordable Care Act allowed the Medicaid expansion, states that declined to opt in have way higher rates of medical debt than states that did opt in. And while thankfully Colorado did opt into the Medicaid expansion program, still 1 in 8 Coloradans have medical debt that has gone to collections. And in total, Colorado has $1.3 billion in medical debt. While having insurance lessens the likelihood of medical debt, those with health insurance are still impacted due to high deductible plans, premiums, and copays, which lead to high out-of-pocket costs for people. We often think of medical debt as thousands and thousands of dollars for things like cancer treatments, heart surgeries, things like that. However, the average amount of medical debt on a credit report is only $579, which indicates that it's much smaller, like going to the hospital and needing an x-ray, things like that, that are actually burdening people with medical debt. And we do know that the burden of this medical debt is not shared equally. So we know that there are many groups that are disproportionately impacted by medical debt. People of color are much more likely to have medical debt than white people, largely due to racism in healthcare. People of color experience worse outcomes, reduced healthcare access, and lower quality of service from providers, which leads to people of color having higher rates of medical debt and higher amounts of medical debt than white counterparts. Low and moderate income households have much higher rates of medical debt than high income households. There's a really high percentage of medical debt in low and moderate income households in collections of less than $200. For birthing people, the cost of pregnancy and or childbirth is extremely high. Paying for those services can take up to 20% of a household's income. And when the gender pay gap is taken into account, the impacts of this on birthing people becomes even greater. For people in the LGBTQ plus community, some reasons that we have higher rates of medical debt include that the community is more likely to be low income. There are high costs of certain drugs such as PrEP, and generally worse health outcomes than cisgender heterosexual counterparts. Given the high cost of gender affirming treatments and extreme income disparities for trans folks, the amount of medical debt in the trans community is even higher than the LGBTQ plus community at large. People with disabilities and people in poor health have more medical needs and therefore more medical expenses. Also, having a disability or being in poor health means that a person is more likely to miss more days of work, which often leads to less income, increasing their chances of incurring medical debt. For young people are more likely to not have insurance and to be low income than even elderly folks. All of these factors barely scratch the surface of how these communities are disproportionately affected by medical debt, but the impacts of the debt on these communities is profound. And with that, I'm going to pass it to Julia to discuss those impacts.
Thanks, Charlie. So yeah, let's talk about how medical debt harms people and harms communities in Colorado. For one, medical debt is bad for your health, and this is true for a couple different reasons. Research shows that people with medical debt are more likely to avoid seeking needed medical care. So this could mean skipping a prescription or deciding not to go to the doctor out of fear of how much it might cost. And when patients delay getting care or they forego care altogether, they're at greater risk of poor health outcomes. It's also really stressful to have medical debt, and stress can make you sick. Studies show that people with unsecured debt have worse health outcomes and even have shorter life expectancy. People with debt are 3 times more likely to have mental health conditions like anxiety and depression, and people with debt attempt suicide at higher rates. Medical debt also takes a toll on people's financial health. Most people with medical debt report cutting back on basic expenses like food, clothing, and rental payments. Most people with medical debt draw down on their savings to pay their medical expenses. Many people end up taking on additional debt to pay their medical bills, like by putting expenses on credit cards, borrowing from predatory lenders, or borrowing money from friends and family. Many people with medical debt are sued by hospitals and debt collectors, and many people end up filing for bankruptcy. The consequences of medical debt are really significant, and all of these things individually and collectively jeopardize a family's economic stability. And finally, and this is where I want to really focus your attention today, when you have medical debt in collections, that shows up on your consumer report or your credit report, and it can lower your credit score. And that can impact your life in a bunch of different ways. Quick consumer reporting 101 for folks, since I know that this is not something that we are typically taught in school. When I talk about consumer reports today, I'm talking about reports that contain information about a consumer that is intended to gauge if this person would be a good person to lend money to. So consumer reports include information about your credit history, for example. And a credit score is a 3-digit score that's calculated based on information in your consumer report. So you can think of it like a grade that you get on your consumer report. Consumer reports and credit scores are used in a lot of different contexts. And that means that people with medical debt on their consumer reports encounter barriers in a lot of different contexts. For example, banks use consumer reports when deciding whether to lend to someone. So this means that people with medical debt have barriers to accessing mortgages, small business loans, car loans, and other forms of credit. Insurance companies also use consumer reports. So people can face higher premiums as a result of their medical debt. Utilities companies use consumer reports. Across the country, employers use consumer reports when deciding whether to offer someone a job or not. In Colorado, we do have some protections in place related to the use of consumer reports in hiring, but even still, many workers here in Colorado remain vulnerable to this practice. And finally, and I'll really underscore this piece since I think it's particularly egregious for many folks, landlords use consumer reports and credit scores when deciding whether to rent to someone. And so this means that many people with medical debt cannot secure housing simply because they needed medical care at some point and it was more expensive than they were able to afford to pay. One study even shows that unhoused people with medical debt remained homeless for an average of 2 years longer than folks without medical debt, even controlling for other factors. So the stakes here are really, really high. Ultimately, we believe that the fact that someone got sick and needed healthcare should not be a barrier to housing or a barrier to employment or a barrier to economic opportunity. So our team, in partnership with many of the folks on the call today, we're exploring how we can take on consumer reporting of medical debt and set up some stronger consumer protections in that arena in the coming weeks and months. So stay tuned for more on this topic, and we're excited to share more about what we're up to in the coming weeks. In closing, I'll just say that it's unconscionable that medical debt is such a common problem in Colorado, and it's terrible that it has such far-reaching consequences. But as a result of these things, this is really a Big Ten issue that can bring together a lot of strong partners from a lot of different arenas, from health advocates to housing folks to small business owners and community organizers. So I think there's a lot of really powerful coalition building that can be done in this space. And so in that vein, if you're interested in supporting this work or otherwise getting involved, please feel free to reach out and we would love to connect. Again, thank you all for your time today, and I'll pass things back to Shar.
Thank you, Julia. So this last bill, and then we'll be going to Q&A. The last bill actually has already been drafted. It's already on the website. It's called Bill 4. If you go to the Interim Committee on Tax Policy, it passed out of the interim committee 5-1. And so that's what I will be talking about is Bill 4, because it should be introduced as written and as currently posted on the website, sponsored by Senator Chris Hansen. So what's the problem? Okay, the problem is that workers in the lowest paid jobs and even some medium paid jobs, if you look at our self-sufficiency standard, many workers can't afford to meet their basic needs on what they're being paid. And secondly, those with the youngest children face the biggest gap between what they are earning and the cost of meeting basic needs. This is on average. So what does this Bill 4 out of the interim committee do? Number one, it increases the state earned income tax credit. In the bill, it references increasing it to 40% of the federal earned income tax credit. And by comparison, this year, the state earned income tax credit is 20% of the federal credit, although for the next 3 years, it goes up to 25% of the federal credit. This would bring it all the way up to 40%. Secondly, it increases the state child tax credit it not only would increase the percent of the federal credit for which people are eligible, but it would also align the definition of a child more with state law, because our current state child tax credit it only covers families where the child is under 6, and the federal government child tax credit that got just such a tremendous impact of reducing childhood poverty before Congress chose to not renew it, even despite its effectiveness. And the federal government covers children under 17. Senator Hansen did mention when the vote came up that, there are placeholder numbers in there. The fiscal impact is rather sizable, and therefore it might need to be a little more tweaked and tailored. But that bill should be introduced at the very beginning of the session, since it's already been written. Both of these bills, well, not only you may have read about the federal child tax credit reducing childhood poverty by 40% for the short time that families were receiving that before it expired. But there have been lots of studies done on both the earned income tax credit and the child tax credit. Okay, at this point, I'm going to turn it back over to Bruce for some Q&A.
Yeah, and I'll go ahead and ask all of our CCLP advocates to go ahead and hop back on camera. We should have a question for a few of you here. We've been gathering them from the chat as we go, but let me mention again, if you have a question that you haven't put in the chat and you'd like to have your voice heard, go ahead and raise your hand in the participant area at the bottom of your screen, and we can unmute you and you can actually go ahead and talk as well. Otherwise, you can continue to put them in the chat and we'll add them here. So I'm just going to get started right away with the ones from the chat. As we have just a few minutes here, trying to keep it down to an hour today. So I've got a couple about SNAP ENT bill. So that's probably going to be for Laura, if you want to unmute yourself. I'll try to sort of combine them into one large question because they're a little bit related. But someone asked, do these resources, meaning the ENT resources, go to SNAP eligibles or to SNAP enrollees, which I think is a good question. And then kind of as a related question, how do we get more SNAP eligibles enrolled? And then will the SNAP ENT opportunities be open to undocumented community members? So I don't know if you can kind of take that as a 3-part question all as one there.
So that was a lot of questions there. Number one, SNAP by federal law has some immigration restrictions on it. And so there's not as much flexibility in having that program be open to folks who don't have work authorization. In order to people who are in SNAP ENT, it's because, first of all, they qualified to get SNAP or food stamps. And then a lot of people who get SNAP or food stamps are not required to also work if they have a young child or they're disabled or they are elderly. And so SNAP ENT, my understanding is it's not technically restricted to just what are called ABODs, which is able-bodied adults without dependents. That category of people does have a work requirement on them. They can only receive SNAP benefits for 3 months if they are not working, and I think it's at least 20 hours a week. That requirement was suspended, the requirement to do job seeking was suspended during the public health emergency. But as the public health emergency expires, that requirement will come back into effect. And so SNAP employment and training is an optional program available to individuals who are already on SNAP, most particularly adults who do not have dependents and who would be able to work, because SNAP ENT helps them find and keep work. And in terms of eligible versus enrolled, that's a much bigger question, probably for a whole other hour.
Yeah, probably. No, I think that was great, Char. Thanks for covering a lot of ground there. Really appreciate that. So another question we had from the chat, Michelle Wallace asked, what programs are targeted for senior citizens? That's a little open-ended, so I don't know who wants to take that, but I think Shara might be in reference to the either SNAP ENT or the adult ed bill, I'm thinking.
Actually, what I first occurred to me, because it was something I cut out of my speech because of time limitations, is everybody on this call should be aware of last year's House Bill 1205. People have probably heard of the senior homestead exemption, which gives people who are 65 and older who have owned their own home for at least 10 years. And it gives that set of people a tax break on their taxes. So who does that leave out? Well, gee, all renters over 65 and then homeowners over 65 who may have moved more recently. So last year's House Bill 1205 said, at least for 1 year, let's give a renter's rebate as well. You know, that if, and this is for seniors only, this is for folks who don't qualify for the senior homestead exemption, but are senior renters most commonly or have moved. The fiscal note's $100 million. That's why they probably just did it for 1 year. But people can access that. If you know senior renters, please be sure they file to get, and it's up to $1,000 if their income's under 25,000, and they can still get something up to about 70,000, and you file for it through Department of Revenue, just where you would file your taxes, and that actually is available regardless of immigration status. What I don't know is whether there might be another bill to duplicate that, or maybe the need for some rental assistance will be handled through the voter approved proposition on affordable housing. But do be sure if you're working with senior renters to make sure that they know about this one time only, but it's up to $1,000, which can be very significant for renters, senior renters.
No, that's a big deal. It's great to flag that, Sharon. Definitely. I think that was a great answer. I was thinking maybe this one might be for Bethany, perhaps. Someone asked if there's any noteworthy criminal justice reform bills that we know about that are coming up this session. I know we didn't talk about them much, and last year we had one that was a major focus of this same event in our legislative session in the Clean Slate bill, but I don't know if there are any that you wanted to mention from this session or.
Well, sure. I mean, there are none that we're leading. We have, partners who have playing a big role in the sort of intersection between behavioral health and criminal justice. And there's a lot of room for improvement in that area, but there are bills. Rep. Amabile is leading a slate of bills that she's been talking about. One involves pregnant and parenting folks who are changing the conditions that people have in prison or prosecutions of that group. And there are others that involve basically trying to reduce the need for criminal justice intervention by providing better behavioral health earlier on in the timeline. And that's a set of priorities that we're likely to want to support. We haven't seen the drafts yet, but that's an area definitely of interest to us. Yeah,
and I know our team is doing a lot of work implementing that clean slate legislation that we were able to pass last year. So that's a big focus of the team for sure. I'm going to go to the medical debt bill questions for Julia and Charlie. And it sounds like people just would love to know more. I don't know how much you can share. As you said, things are still under development. So folks made sure to put in a caveat about that. But a couple of people asked, just what are the aspects of medical debt that the bill might address, or kind of what approaches we might take to addressing medical debt? I think you made a strong case for the problem there, and people are just wondering if you can talk a little bit more about what solutions might look like to the extent that you're interested. to.
Yeah, absolutely. So I'd say there's no shortage of work to be done sort of like along the whole lifespan of medical debt, right? Thinking about how to prevent people from finding themselves in a situation where they've incurred medical debt in the first place. And then for folks who do carry medical debt, how do we best support them and mitigate those harms that come with carrying medical debt? So no shortage of work to be done. I would say in terms of CCLP's focus for the coming weeks and months, we're really thinking about this consumer reporting piece. And I'm not just being dodgy, we genuinely are still figuring out what is the best way to accomplish our goals when thinking about mitigating those harms that I described in the ways that medical debt showing up on one's consumer report can be a barrier for people, a barrier to housing, a barrier to economic stability, a barrier to access to credit, and so on. I think one way to sort of think about consumer reporting of medical debt is usually when we talk about consumers, we're talking about people who buy a product, like a consumer of toothpaste or a consumer of airline tickets or what have you. In the case of consumer reporting or credit reporting, consumers' information is the product and it's being moved between different companies typically. So when we think about it can be helpful to think of it sort of like a pipeline. So it's a consumer's information about consumers' medical debt moving from the place where they incurred that debt to, for example, a debt collection agency, to, for example, a credit bureau like Equifax, if that rings a bell, or a tenant screening company. And then that information moves on to, we call them users, so banks, landlords, employers, and the like. So as we think about how do we mitigate this downstream harm for consumers, we want to be thoughtful about what points along the pipeline need to be adjusted or thought through more carefully to ensure that that flow of information is moving in a way that is still meeting the needs of the industry stakeholders while also I think working in a way that is more appropriate given the creditworthiness goals of consumer reports and mitigates unnecessary and I think unjustifiable harm for those people who, again, got sick or were injured and found themselves in a position where they weren't able to pay their bills in full. So I realize that that there's still a lot of sort of details to be worked out, but hopefully that provides a little bit more context in terms of what we're thinking about in terms of next steps. And again, more to come. And if this is something work you'd like to sort of plug in on, please feel free to reach out. We're still sort of looking to put our heads together with smart folks on this and always welcome additional input. Thanks.
No, that was perfect, Julia. Thank you. There's a couple of questions we're not going to be able to get to in the interest of time because we need to close out the hour, but really appreciate those questions as well. And definitely we can follow up with you after the event, potentially, if you'd like. One person did ask, though, sort of where's the list of bills? How can we find out what's being supported, what's happening at CCLP? And I would definitely encourage you to tune into our website. We put regular updates there throughout the legislative session. And then also go ahead and follow us on Twitter and check out our other social media channels for further content. And we'd definitely love for you to stay connected as the legislative session unfolds. And with that, I'm going to turn it over to Bethany to close us out for today.
Well, thanks everyone for coming. Really great questions. And we're so excited to be working with everyone this session. We look forward to seeing you under the dome. And we'll ask for your support with our legislative agenda, which, as Bruce has said, will be clearer as the weeks go on and we enter the session, and we'll have that information up and available for all of you. So thank you.